So basically what we're gonna do, these are always important, in terms of objectives. My glasses here. So we're gonna distinguish among the different types of hepatitis, okay? We're gonna go over the etiology, the patho, the manifestations, and the complications. We're gonna go through the, some of the management of viral hepatitis. We're gonna go through the etiology, patho, manifestations, complications, and interprofessional and nursing care of the patient with non-alcoholic fatty liver disease, cirrhosis, and acute liver failure. So if you could raise your hand, who has taken care of a patient that has had any kind of cirrhosis of the liver, acute liver damage, okay, a whole bunch of you all, right? What labs have you focused in on when you were when you looked at that patient? Billy, albumin, what else? AST, right? What else? ALTs? Those are the biggies, okay? So immediately you're gonna focus in on those when you have your patients, okay? Obviously, we've got the liver. It weighs about 3 pounds, okay? I've been told it's about the size of a football, right? Everybody knows what we do.
The Chiefs.
What's that?
Let's go Chiefs.
Oh. Well, it's poetic, right? It's right after the Super Bowl. Okay, so functions, you guys should know this. It's just a repeat of your patho. You can also look on the table, page 993. Some of the biggies, obviously, the liver functions. It is carbohydrate, protein, fat, and steroid metabolism. It detoxifies, bile production and synthesis. It converts ammonia to urea. It's also the storage for glucose, a bunch of vitamins and fatty acids. And it also is the breakdown of old red blood cells, white blood cells, bacteria, and hemoglobin, okay? We don't focus at all on the gallbladder. We just know that it's there. Obviously, it concentrates and stores bile. Okay, so these are your liver function labs. I never, ever, ever remember my numbers on my labs, okay? I just know which ones are important to me, okay? So obviously, the AST and ALT are gonna be the biggies. Anytime you have somebody that has some sort of liver disease, you're also gonna be looking at the bili, okay? I'm not gonna focus at all really on conjugated or unconjugated bilirubin. I'm not gonna talk about direct or indirect. The lectures today are really gonna focus on what you're gonna be doing, how you're gonna be taking care of patients that suffer with these, okay? We're not gonna get heavy into the patho of anything at this point. Also, I need to add albumin to this. See it up there. And then your PT and INR, you're also gonna be looking at that as well. Okay, so let's just kind of go through some of this. So you've got your bilirubin, right? Okay. It's a breakdown of your RBCs and the liver excretes it. Okay. What happens with your bilirubin? Okay. What causes? What kind of goes on with it? Yeah. High levels cause what? Jaundice, right? You guys know that. I'm sure you've seen some yellowing of the eyes, right? The sclera. And some of the jaundiced face, okay? There's your level right there for your bili, 0.2 to 1.2. As I said, I never remember my numbers, but the software at the hospitals will always have your normal values, so you don't have to worry about that, okay? The bili is secreted to the bile duct and then excreted from the body in feces. That's what gives it the brown color, okay? And we'll kind of go through some different colors of stool if there is some liver damage. Elevated liver enzymes indicate inflammation, okay, period, end of sentence. When you look at your AST and your ALT, really what that is that you have the enzymes that are breaking down, and the ALT and the AST is what is elevated. So once those enzymes break down, those are elevated, and that's why you see that. That's exactly what's happening, okay? All right, so let's talk about hepatitis. there's a bunch of different kinds, right? We're gonna go through all of them. You have A, B, C, D, and E, okay? There is viral and non-viral. Let's just go right into it. Okay, so what I've done, there's some helpful hints on these once we get through them, and hopefully it'll be helpful to you in determining what kind of hepatitis it is, okay? As I said, there's 5 kinds. You have A, B, C, and D, okay? There's hepatic cell destruction, a bunch of inflammation, you have necrosis, okay? When you have viral hepatitis, there's some really big key things that happen with that, okay? We've already talked about jaundice, that's a huge one, okay? Let's just talk in general. We don't even have to fill in those 3 blanks. What would you anticipate when somebody has viral hepatitis? What would you expect?
Ascites.
What's that?
Ascites.
Maybe, long term, okay? They're feeling really crappy, right? Okay, so you've got jaundice, okay? One of the biggies is anorexia, okay? And also spleen enlargement. Those are three biggies that you should be aware of, okay? There are 3 stages to viral hepatitis. It's not super important that you know what's going on with those stages, but I do want you to realize that there are 3 stages, and as they progress, you'll see jaundice once it starts to kick in, okay? So you have the prodromal phase, and then you have the, I can't even say this, esoteric, I think is how that's called, okay, or iteric. That stage is, that's when the jaundice starts to kick in, okay? And then finally, the 3rd stage is convalescence. So basically, you have a patient that they're not doing well, we don't know what the outcome will be, okay? There is a table that you can refer to, okay, 48.1 if you want, but I pull out the most important things of the table, so you don't really have to focus on that, but just know that these are the biggies. Okay, so hepatitis A, we're gonna go through these, and hopefully, like I said, we're gonna try to remember very easily how you can kind of put them together. Who knows how Hep A is transferred? Yeah, right, okay? So you have all these workers in the restaurants, and let's just say they go to the bathroom and they don't wash their hands. Right? Sounds yummy, okay? So that's how you're gonna get it, okay? So if you can think of it that way, the A, I ate it, okay? Hep A, hopefully that helps. Ingestion of contaminated food, milk, or water, okay? So it's transmitted by fecal oral route. So basically, it's very easy to get, okay? The average incubation period is pretty long, okay? It's about 28 days. Questions about that one?
Question. So when farmers, if they, like, I know they're not supposed to.
Sorry, honey, I can't hear you.
So when farmers poop in the fields and they're not supposed to do that, but let's say that a lot of them are pooping in the fields with all the crops, could that cause Hep A if there's contamination with that? Or would that cause other disease processes?
Well, there's a disease process in pediatrics, but frankly, I don't know how long, does anybody know how long Hep A would like stay active? Bella was asking about farmers and fields, you know, all the manure and the crops and stuff. Yeah, well, like how long it would stay, how long it would stay active, like on the, yeah.
I don't know how long it would stay active, but yeah, I think it's good to wash your produce before you eat it.
Yeah, that's something my mom always said. I'd grab a grape and she'd say, don't do that, you gotta wash it first. So, yeah, yeah, that's exactly what she said. All right, so Hep A, I ate it, okay? Ingestion of contaminated food, milk, or water. These are some of the characteristics, okay? The greatest transmission risk is before any of the clinical symptoms are apparent, okay? So you could have this restaurant worker that hasn't washed his hands, he's gone back in the kitchen, he's contaminated the food, and he could be sick and really wouldn't know it, okay? Does it resolve? Does Hep A resolve? Yes, right? Okay? You might feel really, really lousy for a long period of time, okay, lots of diarrhea and all that sort of stuff, but you're gonna feel really, really lousy, but it will resolve, okay? There is a vaccination for Hep A, and thorough hand washing prevents any outbreaks. Hep B, okay? You can think of it, B for blood, okay? It's acute or chronic. This one's a little bit more complicated, and we'll kind of go through it. The transmission is from infected blood or body fluid enters the body. And you can also have it with saliva or semen or vaginal secretions. So that's obviously much more, has a lot more opportunities in terms of transmission, okay? It can be detected in almost every body fluid, so, but there's no evidence in terms of urine, breast milk, tears, or sweat, okay? So specifically, Hep B is transferred through sex, okay? Blood, saliva, semen, vaginal secretions, stool, or stool with blood, or perinatal during that transfer. Does it resolve? It's right there in the slide.
In the majority of cases, it does.
Yes, thank you. All right. Okay, I know it's early, okay? We're hitting the hot spots here, okay? Hep C, okay? C, chronic, okay? C, chronic liver damage, Hep C, okay? Incubation period is 14 to 180 days.
What stage is difficult to detect?
What's that?
What stage is asymptomatic?
Well, that's a good question. So, what do you all think?
Does it have a prodromal?
It's the acute stage. Acute stage is asymptomatic, so it can be very, very difficult to detect. You could be contagious for a super, super long time. Anybody know how long?
1 to 2 weeks.
1 to 2 weeks. What's that?
And there you are, just sharing needles.
There you go. There you go. Willy-nilly.
As one does.
Okay, causes of Hep C. You guys know this, okay? Body piercing. A lot of people ask me, why body piercing? Well, sometimes the individual that's actually doing the piercing could have Hep C and transfer it if they haven't maintained good sterility, okay? Tattooing, needles, okay, unprotected sex, mother to baby transmission. Do you see the sharing of needles up there? Blood transfusions, okay? All right, guys, you gotta have a joke going here. All right,
Not sure.
what's that?
Body piercing and tattoo.
Right.
What's that?
Right? See, your mom was right. Moms are always right.
So it's like stop getting blood transfusions.
Yeah.
You'll live in love.
Okay, the majority of people who acquire it develop a chronic infection, okay? So this is Hep C, I'm gonna go back, so Hep C, we're gonna refer to it as HCV, and that's what you'll see in the hospital, okay? Don't confuse this with HSV, okay? So HCV. Most people are unaware of the infection, okay? Really important, it's the single most common cause of cirrhosis and liver cancer. To me, that's really scary. You don't even know you have it, and it's the most common cause of liver damage and cancer.
The
What's that?
transmission between Hep C and B are very similar.
They are. So let's go back. Hep B is through blood or body fluids, right? And this one is very, very similar, you're right.
So is specific distinguishing factor that we should know between the two for transmission?
Well, the big thing with Hep B in terms of Hep C, HCV, the textbook really wants to focus on body piercing and tattoo and that sort of thing, needles. Okay. Hep D, D as in double down, okay? It's very, very uncommon. You will probably never see this. Frankly, I hadn't even heard about it until I saw it in the textbook. But we go over it because it's in the book, okay? You can see it on the slide. Hep B virus always precedes this, okay? You can only get it if you have hepatitis B. And is there a vaccine for it?
Would you do the Hep B vaccine?
I don't, like I said, I hadn't heard about this one, so let me check.
Would it be the Hep B vaccine? I mean, it's not technically for Hep D, but if you can't get Hep B, then
Well, there's no vaccine for this. But this one isn't super duper important, okay? As I said, it's just in the textbook, you guys are never gonna see it, so don't focus on this one. Okay. Hep E, hepatitis E virus, everywhere but here, okay? You won't see this one either, okay? It's transmitted through fecal and oral route, usually through drinking contaminated water, okay? I'm not gonna focus on that at all. Okay, let's talk about hepatitis, the patho behind it. The hepatocytes, they're targeted directly by the virus, and then your body immediately has a response to it, okay? The large number of the hepatocytes are destroyed in the acute phase, but basically by then, you already have some sort of liver dysfunction. You see the yellowing of the eyes? I'm sure you guys have seen that. After resolution of the acute infection, can the liver regenerate? Yeah. You know what I heard the other day? I heard that you could literally lose about 90% of your liver, and it grows back, okay? And my question used to be, well, if your liver can regenerate, why do people die of liver cirrhosis, right? You would think, hey, your body's gonna be smart, it's gonna just regenerate the bad parts of the liver, right? Well, it can't. Sometimes when the liver gets so far damaged with all of the scarring that takes place, it can't regenerate. Okay, these are the manifestations of hepatitis, okay? So, we've kind of gone over these just a little bit in just kind of discussing them, okay? Low-grade fever, you're feeling really lousy, the anorexia that we talked about early on, skin rashes, changes in taste and smell, of course those labs, okay? AST, ALT, your billy, your albumin, actually your albumin's decreased, okay? But in terms of labs, your AST and ALT are increased and your billy's increased, okay? One of the manifestations that seems to puzzle a lot of patients is pruritus. What's that? Itching. Do you know why they're itching? What's that?
The bile salts like accumulate under the skin.
Yeah, the bile salts accumulate under the skin. So you're gonna have a lot of patients that are just itching like crazy and they don't quite know why. Okay? Spleen enlargement, indigestion. So let's talk about the urine. What color is the urine? Dark, right? That kind of makes sense, right? And how about the stools? Are they dark or light colored?
Clay color?
Yeah, they're light clay color, yeah. So if you had somebody that you were kind of doing an assessment on, and you know, you've listened to the heart, you've listened to the lungs, and now you're kind of palpating all around, which quadrant would be tender if you suspected that they had hepatitis?
Right upper quadrant.
The right upper quadrant, right? That's where the liver is. Complications, gone through these as well, okay? Diagnostics. We just really need to focus on the liver enzymes, the ALT, your bleeding studies, okay? Why are bleeding studies so important with hepatitis? What's going on with the, what's that?
Does your liver make clotting factors?
Well, what's going on with the spleen? It's enlarged, right? So what happens when the spleen's enlarged?
It overworks, so it's breaking down more.
What's that?
I said it overworks, so it's like breaking down more
And then what
of the red
happens?
blood cells, and then you get anemias and hematologic problems.
Does sequester platelets also?
Okay, hang on to those thoughts, you guys are getting it.
You also get varices.
You do get varices, but specifically, I wanna make sure that you guys will focus on the spleen here in just a little bit, but start thinking through. Victoria, you're right on it with your process, okay? One thing that the book does go over are liver biopsies, okay? That is how they literally diagnosed it. But the book really stresses positioning after liver biopsy. They actually say that you're supposed to lay on your side for 2 hours, your right side for 2 hours. I went to IR while I was at the hospital this past week, and they don't do that anymore, okay? That's old school. So no positioning, they just double check it, double check the site, they'll put the Band-Aid on it and go from there, okay? Actually used to be a test question, one of our test questions. So you're not gonna see that again. Okay, so as a nurse, you're gonna be really providing a lot of supportive care, okay? You're gonna have them on, are you gonna have them on, what sort of isolation, depending on what kind of hepatitis they have, right? They may be on isolation? Maybe, maybe not? What you thinking? It really depends on which one, but yes, depending on which one you have, they would be on contact, okay? So, obviously you're gonna be watching fluids and electrolytes. Diet is huge, right? We really wanna make sure that they're getting some good protein, okay? Well-balanced, high calorie, but not fat. Are we gonna be getting them up regularly, like really like encouraging them to ambulate in the hallways, that sort of thing? No, no, I mean, we're gonna get them up to the bedside. We're gonna make sure that they have the SCDs on, the sequential compression devices, right, at the hospital. But the DVT prophylaxis, what would that entail? Lovenox, right? So you're gonna be doing Lovenox, you're gonna be getting them up at the bedside, that sort of thing. But you do not want to encourage a lot of exercise, okay, when they have hepatitis. Okay, various drugs. The important thing that you recognize here is that there are obviously medications for nausea and vomiting. So some of the antiemetics, okay, they're gonna be feeling really lousy, they're gonna be nauseous. So now that you've been at the hospital now for four, right? 4 clinical days? What sort of medications have you seen given for nausea and vomiting? Zofran, what else?
Raglan.
Reglan?
A ginger ale, but there's no order yet.
Yeah, ginger ale is really good.
Peppermint
Mhm.
oil as well.
Yeah, peppermint oil works great. Have you guys seen the peppermint oil at the hospital?
Yeah.
Okay, it's amazing what it does. It helps with nausea, it helps you pee. We used to use it a lot in women's care. It's crazy, and all they do is just smell the peppermint oil, okay? What about for pitting edema, okay, the furosemide, right? What kinds of medications would you be given for that? For the pitting edema? Furosemide, right? You could be giving any sort of Lasix, right? Any sort of diuretic, okay? Depending on which one you're giving, what labs are you looking for? What labs are you looking at? Your potassium, right? It's gonna be huge, okay? Antipyretics for itching, okay? And obviously you're gonna be encouraging vaccinations for the ones that have vaccines. Okay? if you have a patient that is sexually active, what are you gonna be teaching them? All right, you guys, stop laughing.
To minimize the risk of passing it on to the partner.
Yeah, I mean, you guys had the lecture with Jameson about things and how they transfer, okay? This is just as bad, if not worse, okay? You're gonna be teaching them to abstain, you're gonna be using condoms, that sort of thing, okay? We can't be embarrassed to teach our patients the important news, okay? That is what it is. Diet, okay? Small, frequent, well-balanced meals, okay? They're already feeling really nauseous and lousy, and they're kind of anorexic, okay? So stomachs are really, really kind of minimized, smaller at this point. So we're gonna be saying, hey, just take it easy, okay? Not a lot of exercise, and eat nice, small meals, okay? Hand washing is huge. Avoid sharing toothbrushes. I'm sure you guys are gonna make sure you're telling your patients that. Razors, needles, okay? This is a really funny story, unrelated to this, but I'm gonna tell you it because I think it's important overall. So, when I was in women's care, I had a patient, she was in her early 20s, and she was shaving her legs, and she was also shaving her pubic area, okay? She was using her boyfriend's razor, and she couldn't figure out why she was in the hospital with this horrible groin sore, okay? Well, her boyfriend's razor was just dirty, okay? It was just dirty. He wasn't cleaning it. He had had it for a really long time. So she cut herself with the razor, and it got infected with the razor, and it was nasty. I mean, it was really, really deep, and it was, as I said, right in the groin. So we gave her the education. She was on IV antibiotics for a few days, and then we transferred her to oral antibiotics. She went home. Guess who came back about 2 weeks later? Guess who was still using that damn dirty razor? Right? Okay? So, you'd be amazed what patients will do, even though you tell them not to. All right. Just a quick question. Which of these types of hepatitis results in the highest risk of developing cirrhosis? What was it? Yeah. Okay. I wasn't sure if you were saying Hep B or Pepsi. Okay. All right. Everybody doing okay? Okay. Hopefully you're kind of looking through that case study, just kind of thinking through it, okay? So non-alcoholic fatty liver disease. It's funny when you see that, it makes no sense, right? It doesn't make any sense to me. I didn't even know this existed until I was a nurse, okay? Basically, you have fat deposits in the liver. Has nothing to do with alcohol use, okay? The biggest thing is that you really want to think about the metabolic syndrome. Do you guys remember what that is?
Like insulin resistance.
What's that?
Is it insulin resistance related?
Can be. So,
Cholesterol, triglycerides.
yeah,
More
so,
than one factor.
exactly, it's more than one factor. So you have a patient that kind of has like that triad of all the things that they shouldn't have. They could have hypertension, they could have COPD, they could have cardiac issues. So if you look at the metabolic syndrome, it's a kind of like a circle of patients that all have very similar diseases. Okay, and it all has to do with hypertension, cardiac, obese. Okay, it's sort of like a profile of a person that is more than likely to get non-alcoholic fatty liver disease. So if you can think of it as a profile of a person, that's probably the best way to think about it. And these are really cool pictures. This kind of shows just how the fat deposits in there. Okay. All right. So a lot of people, when they have this, they don't even know they have it, right? So we're looking at their labs. The only way that it can be diagnosed is a liver biopsy, okay? There's no treatment. So what we're going to be telling them, what are we going to be telling them about their lifestyle? What are we going to be encouraging?
stopping drinking and other like liver toxins?
Well, they're not drinking, right? It's not caused by alcohol.
But wouldn't alcohol exacerbate it?
Oh,
So if you had
yes,
that,
yes,
like you
yes.
just, hey, I know it didn't cause it, but you should stop drinking.
Yes, it would definitely exacerbate it if they just decided to go on a binger and they'd never drank before. Yeah,
Would a
definitely.
low-fat
What's-
diet help, like?
Low-fat diet,
Low cholesterol.
yeah.
Something along the lines of the Simple Seven.
What's that?
Something along the lines of the Simple Seven.
Yeah, absolutely.
I can't remember which one is liver and which one is kidney, but NSAIDs or I don't know, I can't remember which one is liver.
That's a good question. So which medication affects the liver? Is it acetaminophen or is it ibuprofen? Acetaminophen, okay? You'll see later in the slide, it's like the number one, reason for liver, liver damage. Okay. So yeah, you're gonna be encouraging low-fat diet, okay? Get out and exercise, lose some of that weight, okay? Probably by this time, they're also diabetic, okay? So it's that metabolic syndrome, okay? So you're gonna be really focusing in on diet, lifestyle, exercise, that sort of thing. So this is something different. This is acute liver failure. We were just talking about it, right? It's the most common cause of acute liver failure is acetaminophen. One thing that we used to get a lot on peds, we had a lot of overdoses for acetaminophen, really, really nasty. And then we also had a lot of patients that would come in and they would go on these bingers on the weekends. So they'd drink all weekend, okay? And then they would feel lousy because they had to get up Monday morning and then they would take too much Tylenol, okay? That in itself can cause acute liver failure depending on how much they're taking, okay? These patients do go to the ICU, and hepatitis B is also the second most common cause. But the thing I want you to get out of here is that the most common cause of acute liver failure is acetaminophen, okay? It's not drinking, okay? Could be a combination of the two, but believe it or not, it's not alcohol. Okay, so let's talk about labs, okay? We briefly talked about some of the clotting with, well, we talked about the spleen, right? What happens in the spleen? What's that?
Filters red blood cells.
Filters red blood cells. What else?
They hold on to platelets.
What's that?
They hold on to platelets.
Holds on to platelets.
Doesn't work.
Okay. So let's talk about this. If you have somebody that has hepatitis and you are getting those labs, what would you anticipate in terms of clotting? What's that?
Yeah,
Acute increase.
high protein and prolonged.
You think it's prolonged? Yes, it is. Okay. These are your main labs. These are the ones I want you to focus on. You don't need to know the numbers, okay? I'll never ask you ranges, nothing like that, okay? But you do need to be aware and familiar with them, okay? So if we're talking about protein and albumin, okay, obviously we're making sure that our patients are eating well, that they're getting a nice, well-balanced diet, okay? What is that albumin doing? What's that?
Oncotic pressure.
Oncotic pressure. So Asa had a patient last week, and you gave albumin, right?
Mhm.
And what was it for?
He was chronically hypertensive or hypotensive. Was on norepi. We were trying to get him out of the ICU and off norepinephrine. So we were
Okay.
trying to increase his blood pressure in a way that wasn't vasopressor.
Okay, so can you tell them why that they would have given albumin?
He was in chronic liver failure, and he was also had a stage 4 pressure injury that was killing him. So he was constantly using the protein in his blood to heal the injury, and he was not making it very well. So he was hypoalbuminic or whatever.
Mhm.
So anyway, we just decided it wouldn't hurt to give him albumin. He's low in it. We could use it. Maybe it helps his blood pressure.
Yep.
It didn't,
Yep.
but,
If you've ever given albumin, what's it like? Is it real thin? It's in a bag.
It's like syrupy.
It's very
kinda
syrupy.
discolored, yeah.
Yeah. So when you're in your clinicals and you give albumin and the pump keeps beeping at you, it's because it's so thick, okay? So your nurses can tell you different things to kind of help with that. Okay, we're still in acute liver failure. This is, remember, what's the #1 cause of this? Acetaminophen, okay? So the first thing that you'll see, changes in level of consciousness. Oh my God, I think that's everywhere, isn't it? That's the first thing that you see with every single thing. Okay, really important. Jaundice, of course, that right upper quadrant pain. You're gonna have some issues with your coagulation, okay? Altered mental status, we already talked about an enlarged spleen, and your billing levels and your liver enzymes are gonna be increased. This is what we're doing, okay? Basically, we're just trying to manage them. We're trying to get them to a place that they're gonna be as comfortable as possible, okay? Because at this point, they're gonna need a transplant. It's gonna be very unlikely that they're going to get it unless they're super high on the transplant list, okay? What's gonna be going on with their mentation? We already talked about they're already gonna have a change of level of consciousness, right? What else would you expect with that along those lines?
Looks like brain fog and things like that, like
Yeah.
trouble with generalized standard tasks.
Brain fog, okay? The encephalopathy, we talked about that with increased intracranial pressure, right? Okay? What happens when you have somebody that has encephalopathy? It just changes in level of consciousness, but also they can get really nasty, okay? Super, super nasty, they can get combative, okay? Which is really strange because they don't have a lot of energy, but yes. Okay, that is all I have for this